Always Investigating this week broke down the numbers on a growing doctor shortage here statewide. Telemedicine, seeing a doctor via your computer or cell phone, promises to cure part of the problem, but it doesn't come without some drawbacks of its own. Gina Mangieri tonight continues her investigation.
As we started digging into solutions to the doctor shortage, one of the big ideas that keeps coming up is telemedicine. It's a way to help one doctor see many more patients than he or she might be able to in the office. While it holds a lot of promise, there are many steps before consumers, doctors, and even policies are set up to make telemedicine all it can be. For more and more patients, when they hear the doctor will see you now, it might be on a phone in the palm of their hand.
Telemedicine has been described as the future of medicine for decades. It's really actually the present of medicine.
Whether it's urgent care assessments or emergency stroke intervention from Queens-based physicians, providing care and consultation by network, camera, and screen is helping Hawaii's strained doctor workforce reach more patients. Neurologists at Queens serve a total of 9 hospitals on a stroke telehealth system.
And they actually activate the hospital before the patient arrives. The hospital pages us, and then we log on to the camera. And when it works well, we actually see the patient roll into the door, and we're able to start examining them immediately.
How can you possibly know to the level of detail that someone by the bedside would?
Right, you can do a lot more than you might think by telemedicine, especially for stroke, because a lot of the signs that we see of stroke relate to being weak or having problems with coordination.
The state's largest insurer pioneered care over the air in Hawaii and even nationwide as main telehealth vendor American Well's first client, maybe a little ahead of its time back then.
More and more as millennials are patients and millennials are doctors, the concept of using technology to fulfill all of your consumer needs, whether it's shopping or medicine or whatever, is just more and more acceptable and is actually more natural.
That's music to the ears of big telemedicine supporters like the state health department's chief of planning and policy.
If I could wish for one thing, it would be an entire population of folks who would be comfortable and walk into their doctor and say, "Doctor, how come I can't see you on my iPhone?" And to create that patient demand.
Easier said than done. Some patients just want face-to-face visits. Physicians have to grapple with costs, privacy and security issues, and their own preferences for bedside care.
About 15% of providers reporting that they have had a telehealth experience. Now that needs to be 75, 85, 100%, close to that.
There are concerns about cost from all sides, doctors, insurers, and patients. Hawaii doctors by state law now have to be paid the same for a telehealth call as an in-office visit. Sometimes mainland doctors will do it for less. How do you keep equity and parity in rate even for doctors who might be crossing state lines, even though it's a state line over the internet?
Yeah, that is, that's actually a complicated question. Is we do have doctors in other, places on the mainland. We have separate contracts with them where they get paid a fixed rate for providing that service. Affordability is a really big issue. We need to look at all the different ways.
Doctors crossing virtual borders happens in the other direction, too. Hawaii doctors serving patients outside of the islands.
When it's nighttime here, it's early morning in Minnesota, and she is able to do some early morning consultations for patients there, supplementing her income.
Another telemedicine shortfall, it can't be used for everything yet.
Wearables, robots, artificial intelligence, big data, all of those things are going to come together to really change the model that we take care of. And the reason why it's going to work and it's going to change is because the younger generation, as they age in, that's what they expect and that's what they're going to want.
The state is working on a statewide plan for telemedicine due by the end of this year. A telehealth council will be convening working groups for all the stakeholders, meant to shrink the hurdles and drawbacks of telemedicine and help doctors see more patients. Gina Mangieri, KHON 2 News.